Thank you very much.
Thank you so much for inviting me for this interview. I think the issue of Parkinsonism and Parkinson's disease has become more and more relevant in all communities as we age. So all societies are aging globally and we have more elderly people. And so many of these conditions, which are geriatric neuro-urological conditions, present to us more and more often. The challenge is that not all patients who have Parkinson-like symptoms will actually have Parkinson's disease. So we know that 1 in 5 will actually have conditions such as multisystem atrophy or supranuclear palsy, etc., which are Parkinson plus conditions. And these conditions do not respond well to prosthetic surgery. And more importantly, especially for MSA, MSA patients can actually present with urinary symptoms to start with. And that becomes a challenge because the patient walks into the OPD, there's no background of neurological symptoms described by the patient or the family, and you have a challenge because you have to pick up subtle signs which might tell you that the patient actually has MSA so that you can avoid an unsuccessful surgery in the patient. Now, with regard to urodynamics, in general, the principle is invasive testing only before invasive therapies. So we would exhaust all the usual therapeutic options in the patient before we would think about offering invasive testing. And that includes optimization of their Parkinson disease treatments. It includes all the usual therapies that we would offer these patients, like conservative management, drug therapy, looking at their bladder diaries, bladder training, pelvic floor muscle training, etc. And if the patient is refractory to everything, and we are looking at some salvage therapies for either their storage dysfunction or their voiding dysfunction or both, at that point, I think it's reasonable to do a urodynamics and perhaps with some of the additional testing tools that we talked about.
And sometimes the diagnosis of Parkinson's disease is not so easy. Sometimes the patient had only bradykinesia, or sometimes he's starting with loose symptoms, and we have to be very to take care about this patient, especially men, to indicate or not some surgeries. So this is very important, this message about Dr. Sanjay. Thank you very much, doctor. It's a pleasure about receiving you here in Brazil. Thank you very much.
My pleasure.